common questions with the VA MSST is the question of the level 0. Why do we have it, and can we use it if a patient refuses? The level 0 is the, start over. The first question on the VA MSST is, does the patient walk without loss of balance or sway without any assistive device? And that's for somebody like you or I who comes into a clinic and is clearly walking without any compromise, without any noticeable loss of balance, no assistive device. Remember, the VA MSST is used for not just inpatient settings, but ambulatory care, specialty clinics, outpatient, home care scenarios. So there may be times when you've already observed your patient to be clearly a level 4, an independent ambulator who is safe without an assistive device. In that case, you've made your observation, you've screened your mobility, and the patient is a level 4. You do not need to put them back into bed or back into a chair and go through all the steps. So that first question on the VA MSST algorithm gives you a way of assigning a level 4 when that is clearly indicated. On the inpatient setting, most likely you're going to come across your patient in bed or in a chair, and so you're going to go through the screening process. The level 0 is for when a patient is unavailable. And we need to remember the VA MSST is a tool that spans the continuum of care, not just ICU and acute care, but our CLCs, our skilled nursing, our long-term care facilities. So if a veteran or a patient is out on a day pass or is at a procedure when you are coming to do the mobility screen, you need a way to write into your note that the patient was unavailable. Because the VA MSST must be observed in real time, you cannot assign a score that was given earlier when you do your screen. You must be with the patient to observe directly what they're able to do to assign a score. So if the patient is not available, that's when you're going to use the level 0. Let's say in acute care, you're working day shift and you're almost at the end of your shift, you haven't completed your all the parts of your assessment yet, and you have your entire shift to complete your shift assessment. You go to get the patient to do your screen to complete that part, and the patient's off the unit. That's when you're going to use the level 0. If a patient refuses, we want that entered in a text box that the patient refused. That is different from being unavailable. So we need to make that distinction. We're going to show you how to go through the screen quickly from start to end with a patient that completes all parts of it, just so that you can see how quick and easy it is. One of the questions we get a lot is, how can we build this in? We don't have time to do just one more thing. The VA MSST, or the mobility screen, is not extra work that you're being asked to do. You're already making decisions about how a patient can get up. What do I do if they need to go to the bathroom? How do I get them into the chair? You're already making these decisions. The VA MSST just gives you a standardized and consistent way to communicate across team members within one discipline, so from day shift to night shift on nursing, or you have float staff or somebody covering your patient. When they know the MSST score, it tells them exactly what the patient needs help with. So let's look at what it looks like to go through start to finish for a VA MSST screen. Tim, you want to go to the bathroom? Let's go ahead and get you up. Go, can you sit up for me? Legs over this side. Super. Can you shake my hand across midline? Excellent. Can you stretch and point each leg? Great. Pump the gas. Same on this side. Pump the gas. Okay. Go ahead and stand for me. 1, 2, 3, 4, 5. Super. March in place. And just step forward and back with each leg. Excellent. Have a seat. In fact, you can lay right back down again. That's it. That's as quick as the VA MSST is. And it gives you a level that you can then communicate across all team members from one transition or from one care setting to the next, from physical therapy to nursing to respiratory therapy, occupational therapy. We are all speaking the same language. So let's break it down a little. The first step is sit and shake. We want to know, can this patient sit unsupported at the side of the bed and cross their midline safely and independently? Go ahead, Tim, and sit up for me, and you can. Swing your legs around and shake my hand. Excellent. Tim is sitting safely, unsupported, without any help from me. So he passes that first step. And the way the VA MSST works is you start at level 1. You start with us assuming you cannot do anything without help. Once he has passed the test, the sit and shake, he has moved out of 1 territory and he's now in that level 2 territory, and we need to test further to see whether he stays in level 2 or whether he moves on into the next territory, which would be 3P, as you follow your VA MSST tool. So we already know he's a level 2 because he was able to sit and cross midline without support in his lower back. My next question is, are his legs strong enough to try and let him stand without any kind of assistive device or support? So this is where the stretch and point comes in. Stretch and point one leg, point your toe. You only need to be able to do this on one side to pass level 2. So what that means is if you've got a patient who's had a stroke, who is strong enough on one side, they may be weak on the other side. But if they have one strong side, you can go on to try and have them stand. Or a patient who has an amputee, you can stand them as long as they are strong on one leg with a stretch and point. So he passed the stretch and point. He is no longer in 2 territory. He's now into a 3P territory. And I'm going to ask him to stand to see if he stays in 3P or if he moves on to a 3N. The question for a 3P to see whether he passes to a 3N is, can he stand without any loss of balance for 5 seconds with or without support? And the support can be the bed rail, the support can be a walker, or the support can be a non-powered stand aid. So let's look at that. Tim, are you able to stand? Let's look without support first. Go ahead and stand up for me. 1, 2, 3, 4, 5. Okay, great. Have a seat again. He passed the standing without support. Now let's look and see if he needs to hold the handrail. So you can stand, but with help of the handrail. You're a little bit, not quite as strong as you were without support. 1, 2, 3, 4, 5. He's still past the 3P. So the answer to our question, have a seat again, can the patient stand with or without support for 5 seconds without loss of balance. He was able to do that with the bed rail. Now let's say he uses a walker at home. Or he has been assigned a walker for his hospital stay. Let's say I ask him to stand and he uses the walker. You use the walker, 1, 2, 3, 4, 5. He has passed level 3P. Go ahead and have a seat again, Tim. Let's say he's a little unsteady with the walker and he has a hard time lifting with the walker. We can also use a non-powered stand aid. Yep. Bring this in. Maybe switch that way just a little bit. The difference between a non-powered stand aid and a powered stand aid is that the powered stand aid needs a sling and has a motor somewhere on it with a hand control. The non-powered stand aid, there are many different kinds. Some have removable foot plates, but they all have this flap that goes down behind the patient's bottom in case they lose balance, and they have this knee support and the patient can pull up on them. So, Tim may not have been able to stand without loss of balance with his walker, but let's see if he can do it with a non-powered stand aid. Go ahead, Tim, and stand up for me. And you can pull yourself to stand here. Yep. Go ahead and pull up. Loop the flaps down behind you. 1, 2, 3, 4, 5. He has passed the 3P test. We're now in 3N territory. So regardless of whether he did it without support, using the handrail, using a walker, or a stand aid, we know he does not need power to help him stand. He can stand with or without support, independently and safely. Let's say the next step is, can he pass through 3N territory? So he's already passed 3P, we're in 3N territory, and the question we have is, does Tim need help to walk? So let's start, since you're in the most supportive stand aid. In this position, Tim, can you step, march, and can you step forward and back? All right. We know that he can march and step with assistance. We don't know yet if he can march and step without it. We need to do the march and step without support to check that. So have a seat again. Let's say he was able to stand safely with the walker. So go ahead and stand up. We've already shown this. He was able to stand 1, 2, 3, 4, 5. We're no longer in 3P territory. Now we're in 3N. He was able to stand. I want to see, is he able to walk without help, or does he need help to walk? So let's march and step here. March and step forward and back. Okay. He is safe. He passed the 3N test. So he is now a 4A because he's using an assistive device. If he had walked with the stand aid, he would have been a 4A, walking with an assistive device. If he's using a cane, the same thing, walking independently with an assistive device. Go ahead and have a seat again, Tim. Let's say he stood, go ahead and stand, and we've done the 1, 2, 3, 4, 5. If he is absolutely fine, there's no loss of balance, he's never used a walker, he was fully independent before, we could go on and just do the march and step here without support. If you felt support was necessary and you don't have a walker in the room, you've got the railing of the bed to hold on to. So if you're in any doubt at all about the patient being able to march and step safely and independently. If he's even a little bit off balance, I'm going to have him hold on, and we're going to do the march and step with support first, and then go on to the march and step without support. So if he can do it all without any support, he's a level 4 independent ambulator. If he was able to march and step safely with his support, he's a level 4A independent ambulator with an assistive device. And that could be a cane or a walker or crutches. If he is a level 3N, so let's back up now and look at what happens when we are not able to pass those tests. We showed you just a moment ago what it looks like to pass the 4 and the 4A. Let's come back to that 3N territory again. And we've already stood, but we're looking to see, can this patient walk with or without an assistive device independently? So we're going to test that march and step. We're going to test the march and step again, Tim, but this time you're going to be a little off balance. All right, so let's go ahead and march and step with your device. Okay, and step forward and back. Okay, and have a seat again. In this case, Tim failed the march and step with support. So we know he's able to stand. He passed through the 3P. We were testing to see if he could move out of 3N territory. The answer to that question, can he march and step independently and safely with support, was no. When he tried to take a step, he lost balance. So the 3N patient, he remains 3N. He's able to stand, but he needs help, even with a device, to safely walk. And that device could be the non-powered stand aid that's got the knee block in case those knees buckle while he's walking. All right, so that's somebody who passes a 1 and a 2 and a 3P, but they failed the 3N, and we know they need help to walk. Let's back it up again. He's in the 3P zone, which means he's past level 1, he's past level 2, and I need to see if he can stand. Let's say we've tried standing without support, and he wasn't able to do it. So go ahead, Tim. Let's hold on. I'll put this out of the way. So go ahead and try and stand, and you can't get all the way up. Okay. Let's try it with a non-powered stand aid. That one just a hair. This time you try and stand, and you're not able to. Pull, 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 up, 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 up. Okay. So in this case, Tim is not able to stand even with a non-powered stand aid. So we tried standing without an aid. We tried standing with the stand aid. He was not able. So he is remaining in the 3P territory. We know he can sit himself up. He passed level 1. He can sit unsupported. We know that he has strength in at least one leg for these muscles, but he doesn't have the strength to stand up even with a non-powered stand aid. He needs power to help him stand, either with a powered stand aid or with a ceiling lift, with a walking harness, but he needs power to stand. Let's go back to the next level. He's been able to sit unsupported at the side of the bed, so he's past the sit and shake. Let's check the strength for his legs and go ahead and try and you don't have the strength on either leg to straighten it out, we know that he remains a level 2. He was already in 2 zone because he passed the sit and shake, but to pass out of 2, he's got to be able to stretch and point. He was not able, so what that tells me is his legs are not even strong enough to do that stretch and point. I can predict with a fairly high confidence that if I try and stand him up with weak legs, those legs can buckle and he's at very high risk of falling or me catching him or buckling when we try to stand. So if a patient fails to pass through level 2, they remain a level 2, you know you need a powered device to even try standing. Doesn't mean he cannot stand and walk, it means he needs power to safely do that for him and for you, the caregiver. Okay, let's go back and talk about level 1. So level 1 is asking the patient, can they sit unsupported at the side of the bed? How they get there may vary. The first way they can get there, go ahead and sit yourself up under your own steam, Tim, and you can do that, no problem. Swing your legs around, shake my hand, great. He was clearly able to sit up by himself. Go ahead and lay back down again. There are some patients that never lay flat, especially some of our bariatric patients who cannot tolerate the flat supine position. Many of those patients sleep at home in a recliner or in a semi-reclined position. Or they may have had abdominal surgery, in which case they are not to put too much strain on their abdomen. Or their abdominals and their core muscles may be weak in terms of sitting up, but once they're up, they're able to stand and they're able to walk. So for the VA MSST, it is permissible to use the head of the bed to help get the patient up to the side of the bed. We just have to know what the reason is that they cannot sit up by themselves. Tim, from this position here, are you able to use a side rail and come around onto the side of the bed? Okay. Now the question for that level 1 is, can he now sit unsupported now that he's there? And pass and shake my hand across midline. He was able to do that, so he still passed that level 1, even though he used the head of the bed to get there. Now let's say, go ahead and come back again, Tim. Let's say we've raised the head of the bed and he comes around to sit. Go ahead and bring that, and you're not able to this time, right? And he can't. Can you come forward? You fight it, but you can't make it. This is a patient who has failed level 1, so they remain a level 1. They're not able to test out of it. Okay, you can put back in again. For level 1 patients that are not able to sit unsupported, this patient needs help to sit up. They need either a sling, repositioning, a seated sling, or one of the ambulation harnesses or mobility harnesses that can get him up, because he is unable to sit unsupported at the side of the bed. Go ahead and come around again, Tim. The other question we get a lot is, what if the patient is able to stand from a higher surface but not from a lower surface? So let's say, Tim, we've done the screen, you can sit, you can shake, you can stretch and point. Okay, go ahead and stand. Let's say you're using a walker at home and you can stand. 1, 2, 3, 4, 5. Can you march in place and step? Okay, so he's passed all the tests. Now, because Tim uses a walker at home all the time, we're not even going to test without an aid. He is a 4A because this is his normal way of getting around. Let's go ahead and step around Tim and have a seat in the chair. Okay, hands down to the chair. And he's sitting in the chair for a while. And now perhaps he wants to get up. Let's say it's an hour later, a couple hours later, and Tim wants to get up and get back into bed. Or he wants to go to the bathroom. Earlier on, when we assessed him, when we screened him, he was a 4A. So we see on the communication board, we see in the chart, Tim's been a 4A today. He's been walking around with his walker. He's doing really well. Now he's been in his chair for a few hours and I go to get him back to bed. This is why we do the screen every time we get the patient up. All right, and this time you're tired. Okay, so Tim's been sitting in the chair. All right, Tim, can you sit forward for me? Good. So the sit and shake in a chair, you must be able to stay away from the back of the chair. Great, stretch your legs out for me. And those are still good and strong, good. Up and down. Okay, great. Here's your walker. Go ahead and stand up for me. You can almost make it a bit up. Okay, all right. Try one more time for me. You're even worse. Okay, so clearly at this point, Tim is not able to stand with his walker. So the question we have is, do I need power to stand him, or would a non-powered stand aid enable him to get up? We're going to try the non-powered first. So, yep, hands inside the right, sir, and you can stand with this. All right, try that again, Tim. Are you able to stand up? Okay, you just needed that to pull on, huh?
Yep.
Okay, and then let's go ahead and walk back to bed, Tim. Turn around. Back it up. Can you get your own flaps there? And this one. Great. Put the brakes on and down. Super. So Tim, in that moment, was a 3N. He needed the non-powered stand aid to be able to stand him up and walk back. He was able to march and step a little bit, but given that I was supervising him, bringing him back with the non-powered stand aid, he's needing help to walk. Had he been able to walk back with his walker, then we would have used the walker. But because he was a little bit weaker, we rated him a 3N. Now, there may be times when the environment changes what the patient is able to do. You see here the bed is higher by about 3 inches than the height of the chair. So this is the value of the VA MSST being a just-in-time screening tool. Tim might be a 4A when he exits the bed, but if he is unable to stand by himself from that low height, we may use those devices because in that moment, from that chair, he needs power or non-powered stand aid to stand up. His arm strength was not enough to push him up from that lower chair. So there's a couple of options there, right? We could get him a higher chair and he would then be able to walk around with his walker. But we must do that screen from wherever the patient is at the moment the patient needs to be moved. We cannot assume that a 4A is always going to be a 4A, because the other thing that could affect it, let's say this chair was the same height as the bed, but Tim has been up for several hours. Maybe his pain meds have worn off. Maybe he's exhausted, or there's fluctuations in his mobility throughout the day. His mobility could change from a 4A to a 3N or even a 3P just from those factors. So we must do the screen every time we go to get the patient up. Let's review it one more time. Go ahead and lay back down, Tim. All right. A level 1, can they sit up unsupported at the edge of the bed? Go ahead and swing yourself up, all the way around. Remember, they can use the head of the bed or a sling to get there, but once he's there, he must be unsupported. If he's unable to do that, if he cannot sit up and hold himself unsupported, we know he needs help to sit up and quite likely all of the other movements. All right? If he passes the sit and shake, we now know he's already in territory 2, and we're going to check his leg strength to see if he can stand up. Go ahead and stretch and point for me, and stretch and point this side. Strengthen his legs, passes him to the next level to test if he can stand. Let's look and see what that looks like as a fail. You stretch and move a little bit. Okay, what about this one? All right. He remains level 2. He did not pass the stretch and point, remains level 2. He needs help to even try and stand up. I'm not even going to try standing without getting a powered stand aid because I already know his legs are weak. Let's say he passes level 2. We're in 3P territory. Can he stand with or without assistance or without support? Go ahead and stand up for me. 1, 2, 3, 4, 5. Have a seat again. That is a pass of 3P. Hold on here. Go ahead and stand up. 1, 2, 3, 4, 5. That is also a pass of 3P. Have a seat again. Bring the walker in. Okay, go ahead and stand up. Hold your walker. 1, 2, 3, 4, 5. That is also a pass of 3P. Have a seat. Let's say the walker wasn't quite enough and we're using a non-powered stand aid. You can use your arms to pull up here, Tim. Ready? Pull. 1, 2, 3, 4, 5. That is also a pass of 3P, where he was able to pull himself up without any loss of balance with a stand aid. Let's look and see what that would have looked like if he'd failed. Go ahead and have a seat. All right. Can you stand up here? Failing. All right, that is a fail. He remains a 3P. We know he needs power to help him stand. If he fails with a walker, you stand back over you. Up. Okay. That is also a fail of the test out of 3P. I know that he needs power to help him stand up. All right. So he would remain a 3P. Let's say he's passed the 3P test. You'll be able to stand. 1, 2, 3, 4, 5. He's now in 3N territory. He's able to sit up unsupported. He's able to stretch and point. He's able to stand. Can you step without assistance? March and step, and you pass it. He is passed into 4A territory. Let's see what that looks like if he fails. So go ahead and march for me and step forward and back. Okay, have a seat. he's failed to move out of 3N territory into 4, which is independent walker. He needs help. He's able to stand, but he needs help walking safely. So I would most likely go to a non-powered stand aid that has walking capability, or like a ceiling lift with a walking sling. All right, let's say you go ahead and stand up again, and you've passed the march and step with support. If he does not normally use a walker, we can take it away. And can you march and step without support? Good, and forward and back. All right, this is an independent walker level 4. Let's say we did not have a walker in the room and we tried the march and step without support, forward and back, and you fail. Okay, we could try that with support. Hold on, Tim, let me get the walker, or hold on to the bed rail, and let's see if you can do that holding on. Hold on to the bed rail, and you can pass it with the bed rail and go forward and back. Okay, so he could be a 4A. We need to get a walker in and test him. Have a seat again. So hopefully what you've been able to see is that this is a quick and easy screen that you can build into that decision you're making, and then you can have the equipment readily available. Let's say you've got a patient who's 3P, you know that you need power, so you get the sling, you get the lift, and you have it ready. Let's say you know your patients are 3N or 4A or a 4. You know by that level that that patient should be able to go to the bathroom or transfer bed to chair quickly. So it helps you plan your day. Now, yes, there are changes throughout the day and you're going to document them, but most of your patients are going to stay the same level from morning throughout the day into the evening. One more thing that we want to cover is who can change the score and when can we change the level of equipment. The RN is going to do the assessment of the screen and document the mobility need assistant or the mobility assistance needs in the shift assessment and in the admission assessment. An aide or an unlicensed person is not going to be assessing the patients. That's why it's called a screen. They are going to be trained to know when there's been a deviation from what's on the board, like what we showed you in the chair. So let's say the VA MSST says 4A, it says it in the chart, it says it on the board, and when the nurse aide went to get the patient back to bed, they needed to use a powered device. It is absolutely acceptable to use a device that is more supportive. The aide is not going to change the assessment. The aide is then going to go back to the nurse, or the PCT is going to go back to the RN and say, hey, I saw that Tim was a 4A. He'd been a 4A for me earlier in the day, but I had to use power with him to get back from the bed to from the chair to the bed, or from the toilet, wherever the transfer was. The RN can then come back in and reassess. Is it because of pain? Is it just that the chair is lower? Is there something going on with that patient? We have had unlicensed care members pick up significant changes in the mobility that when the RN has come back in and done an assessment, there has been something new going on with that patient. We've seen acute UTIs, new chest infections or pneumonias, and we've even had somebody pick up a patient who was stroking, who was having a stroke. The aide did not know any of the diagnostics, did not know the assessment piece, but they were able, because we've got a standardized language now, and we're able to determine if there's a deviation. It gives us a way to tell that something has changed in the mobility. And that can be highly valuable in alerting the primary care team early to changes medically. So if there's a change, a decline in the mobility level, we need to bring in the nurse to assess that, to say, is it because the chair is lower? Is there a reason we can explain this, either medically because their pain meds have worn off, or they're just fatigued, or this is their pattern? Or do we need further workup to see if there's something new medically going on with the patient? We hope this has been helpful to you in seeing the VA MSST not just as one more thing to do, but as a really crucial tool to help you do what you're already doing, but do it in a way that helps you streamline your workflow, that helps you have the equipment available, that you know what your patient's going to need, and you also know how long the patients are going to need to move. A level 4 or a 3N patient, they're going to be able to move fairly quickly. Your 2s and your 3Ps, those are the patients that are going to take the most time. For example, getting them up to the bathroom, getting them into a chair. They're also the highest risk for falling. So for those patients, when you do your intentional hourly rounding, when you have 15 minutes for going to the bathroom, you can say to that person, Tim, we're going to go to the bathroom right now because I have the time right now to get you up. Patient may say, I don't really need to go right now. Let's give it a shot anyway. More often than not, when they go to the bathroom, they're going to void. What happens traditionally is we do the hourly rounding. Tim says, no, I don't need to go. We get him back into bed and we're back at the station 3 minutes later. Either Tim rings his call bell 5 minutes later, you know what, I do need to go to the bathroom. Or he didn't want to bother you, so he waits till you're gone a little bit and then he tries to get out of bed by himself and we find him on the floor. This is where so many falls happen. So by using the VA MSST levels, you can really start to prioritize your day and work the things you have to do anyway into your care planning, into your workflow in a way that helps you when you have those moments of time. I know that there's very rare that you have that time, but if the patient falls on the floor, you're going to spend that time anyway. If the patient develops a pressure injury because we didn't get him out of bed, we're going to be spending the time anyway. So this tool just helps us all do what's best for the patient, keep the patient truly at the center of our care decisions, but helps us prioritize and work out those tasks that we have to do to care for the patient in a way that makes sense for all of us. Anything we missed? Okay.